Hello, I am Michelle Hemingway. I'm an Adult Health 1 in Section 11, and I'm going to be doing an IV medication through a mini bag. I've already gotten my basic IV started, so now I'm going to be doing antibiotic infusion through the mini bag. So the first thing I'm going to do is implement my standard protocol, ensuring that I have checked the patient's MAR versus the doctor's orders. I am going to identify the patient by two forms of ID using the patient's date of birth and the patient's name, which I have already done. I've already washed my hands, and now I can begin preparing my procedure. So the first thing that I am going to make sure that I do is have my vancomycin, which the doctor's ordered, 500 milligrams to be infused 100 milliliters per hour. It's my responsibility as the nurse to ensure that I calculate the correct drip factor, or drops per minute, which I have done here, as seen on the TV. So I have 100 milliliters times the drip factor of 10 over 60 minutes, which comes out to 16.66, which rounded up is 17 drops per minute. As a nurse, it's also my responsibility to make sure that I understand why the medication is being given. So the reason that vancomycin is typically ordered is because the patient has an infection or they're trying to prevent an infection, depending on the situation. In this case, it's probably to prevent an infection, or because the patient has an infection and you don't want to prevent any further infection. I also need to make sure that I understand that there are adverse side effects, which include nephrotoxicity and ototoxicity, so I need to be aware of those if the patient does exhibit signs and symptoms of those. And also need to be aware of patients' allergies in case that they have any allergies to this medication and want to be sensitive to that. So now I can begin doing my IV. So the doctor has ordered vancomycin, so I have my vancomycin pulled up, and I've had it pulled up, and I want to check to make sure that the expiration date is correct and that I'm giving vancomycin, which it is. The next thing that I want to do is I want to make sure that I clean the port where the vancomycin is going to be inserted to ensure that there are minimal risks for spread of infection. Then I'm going to go ahead and insert the vancomycin into the saline bag. Using the scoop method, I will recap that needle to make sure that I don't put myself. And then I'm going to make sure that I mix the medication like so versus shaking it to minimize the risk of bubbles that could get in. And then I also want to make sure that I label my medication bag. So I'm going to label it with the client's name, the drug dose, time of administration, and my initials onto the bag before I hang the bag. After that, I want to go ahead and get my IV tubing prepared, which is right here. I want to label the tubing with the date, time, and initials that I have of me, that way people coming behind me know that I was the one who started the IV. I'm also going to go ahead and connect the two. Again, cleaning, making sure that we have everything clean. Then I can go ahead and hang my bag. I also want to go ahead and prime, filling the chamber half full with the fluid, unclamping my IV to make sure that the tubing is free of obstructions. Which in this case it is. So we can begin the rest of the procedure. So I'm going to go ahead and put some gloves on, which I should have done previously, so I apologize about that. I have already washed my hands. And before I attach this to the patient, I again want to make sure that I clean both sites with an alcohol swab. Again, reducing the risk of infection to the patient via an IV line. Okay, so I've identified my client again like I did before. I have also explained the procedure to the client at this point as to why the medication has been ordered and educated them properly. Again, double checking to make sure that the patient has no allergies. I want to make sure that the patient has no obvious signs of infection, phlebitis, You want to make sure that there isn't any infiltration of the IV itself. So at this point, I want to go ahead and clamp and unclamp the line. And then I also want to go ahead and establish a flow rate, making sure that I watch and calculate 17 drips per minute on my IV medication itself. And then I want to also observe the infusion rate, making sure that it is 17 drops per minute as I calculated earlier. And then I will disconnect the tubing using, after the infusion is over, I'll disconnect the tubing using the aseptic technique, and then applying new sterile needleless device for the next administration. Again, I'll dispose of any needles in the sharps container as needed. Should have flushed my line. Okay.